Now that we've covered some of the major categories of the psychological disorders, we're going to begin to talk about therapy or treatment for these disorders. And when we started this course, chances are most people thought of psychology as being the type of field which is characterized really by clinical psychology or more specifically psychotherapists. Um, and that comes from the fact that when we think about psychology, we tend to think about psychological problems, and we tend to think about Freudian types of treatment because that's largely what has been historically portrayed in the media, and also that that's sort of how psychotherapy got its start with psychoanalytic techniques that were developed by Freud. Now, when we talk about psychotherapy, we're really just talking about techniques that are employed to improve psychological functioning as well as to promote adjustment to life. And so we're going to talk about some of the different approaches to therapy, of which a major portion will be psychotherapy. Now, although we're going to talk about talk therapy and behavior therapy as being different approaches to psychological therapy, really that's somewhat of an arbitrary distinction. That is, many times you'll see both so-called talk methods as well as more behaviorally oriented methods employed within psychotherapy. The best example of this would be, of course, a type of therapy that is the most prominent type of psychotherapy currently being practiced, which is called cognitive behavioral therapy. Cognitive referring to the talking aspects of it, and behavior referring to the behavioral aspects of it. So within the different talk therapies, we'll talk about psychoanalysis, again, which is the very first type of therapy that was developed really by Freud, and its more contemporary version, psychodynamic therapy. We'll talk about humanistic psychotherapy, which is often called client-centered therapy, developed by Carl Rogers. And then we'll talk about two different forms of cognitive therapy, one called rational emotive behavior therapy, and one called cognitive behavior therapy that I just mentioned. Now, in terms of the more behaviorally oriented approaches, we'll look at how classical conditioning, operant conditioning, and observational learning can be employed in order to treat psychological disorders. And then finally, we'll look briefly at some biomedical approaches, which include attempts to manipulate the biological functioning of the individual, specifically through their brain functioning. And the three methods that we'll talk about are psychopharmacology, or the use of medications, electroconvulsive therapy, and psychosurgery. Okay, so in terms of these talk therapies, as I said, the distinction between what would be considered more a talk therapy and a behavior therapy is sometimes a little bit blurred, but it is a useful distinction to make. The talk therapies are a variety of therapies that emphasize communication between the therapist and client, whereas in behavioral and biomedical therapies, that plays less of a role, the communication between the two. So as I said, the three types that we'll look at are psychoanalytic, psychodynamic, humanistic, and cognitive. Okay, so as I said, this is probably the type of therapy that most people associate with psychotherapy, psychoanalysis. This is a Freudian therapy that has been designed to bring unconscious conflicts into conscious awareness. In traditional psychoanalysis, the central belief here is that these unconscious conflicts among the id, ego, and superego, which we talked about, are responsible for most of an individual's psychological problems, and so the goal is to try to bring those conflicts into conscious awareness so that they can be resolved through techniques such as free association, dream analysis, things that we'll talk about in a second. So there are essentially 5 psychoanalytical techniques that are typically used to attempt to bring these conflicts into consciousness. These techniques are necessary, or are from this theoretical perspective, are believed to be necessary because the ego has some strong defense mechanisms that we talked about previously that block unconscious thoughts from coming to light. Okay, so these are techniques that are largely used by psychoanalytic practitioners. So free association involves just saying whatever comes to your mind, with the idea that if you just, most people have blurted things out before, without really giving it much thought, and sometimes you blurt things out that you regret having said. You wish that you could take them back. That's sort of the idea behind free association, is that when you just say whatever comes to mind without attempting to inhibit yourself, that's one means of accessing what's going on at an unconscious level. Okay. Now, this is also the type of therapy in which, in traditional psychoanalysis, a patient would lay on a couch, and the therapist would actually be behind the patient. And the idea here is that the therapist doesn't want to influence the content of the patient's thoughts in any way. That's the reasoning behind sitting behind and laying on the couch, is that there's less chance that the therapist will influence what comes out, and increases the chances that it will be a reflection of the unconscious. Dream analysis is another component of psychoanalytical techniques. We've talked about how, from a psychoanalytic perspective, dreams have 2 types of content: manifest content, which is what's sort of going on on the surface. It's what you actually remember about the dream. But then he said that there's also this latent content, which is the underlying meaning of what the manifest content was. And it's really the latent content that is believed to be more of a reflection of the unconscious. The analysis of resistance is also believed to provide some information about the unconscious. Resistance is essentially anything that the patient does that disturbs or prevents the therapy from moving forward. So in the case of free association, if a patient were to say, I can't think of anything to say, or if they said they couldn't remember their dreams, or if they simply just didn't show up to therapy, those would all be things that the therapist would attempt to interpret that resistance. Transference is when it's sort of like the projective test that we talked about before. It's the idea that a patient will project onto their therapist, or project might not be the right word here. The patient will treat the therapist similar to the way that the patient has treated or behaved toward other important figures. Primarily, in Freudian psychoanalysis, the concern is what happened in early childhood, and so the way that a patient behaves toward the therapist is believed to be a reflection of their previous relationships, and so that's another opportunity to assess, because this is unconsciously the patient is behaving toward the therapist in a way that reflects how they've experienced previous relationships. And so interpretation is a very important part of psychoanalytic therapy. During all these things: free association, dream analysis, resistance, transference, the analyst attempts to find patterns and hidden conflicts, again, to interpret what the underlying meaning of these things is. Now, psychoanalysis, although it is the first form of psychological therapy that was practiced, is becoming less and less common, because there are some major criticisms about it. One has to do with the fact that it has limited applicability. That is, it's very time consuming. Traditional psychoanalysis occurs over the course of 4 to 5 sessions a week, often lasting several years, which can be quite expensive. And it's also going to be limited to individuals that are high enough functioning to be able to do that. So, for instance, somebody with bipolar disorder or schizophrenia, they wouldn't be able to participate in this form of therapy because they just wouldn't be able to sustain that intensity of the therapy. Now, the other major challenge for psychoanalysis has to do with the lack of scientific credibility. Once again, this lack of empirical testing into psychoanalysis is something that we've talked about previously in the context of personality. Many critics say that it's difficult, if not impossible, to document the goals of psychoanalysis, such as determining whether something is truly a reflection of the unconscious, or what the true symbolic meaning of dreams is. However, I will say that it's not as if there's no evidence in support of the use of psychoanalysis, and certainly most people probably wouldn't be practicing it if they didn't believe themselves that it worked. It's just that there are different standards that are used to determine what's considered effective versus ineffective in terms of research studies, and psychoanalysis tends to be somewhat limited in terms of the types of most rigorous research studies that some of the other forms of therapy have used to demonstrate their efficacy. Now, modern psychodynamic therapy is a briefer, more directive contemporary of psychoanalysis, as I mentioned earlier. It focuses more on conscious problems and or conscious processes and current problems. So in this case, the patient is treated face to face, and the therapist takes a more directive approach. And it tends to be less focused on childhood and things like that. Now, the humanistic therapies are largely we're talking about client-centered therapy here. This is a therapy that seeks to maximize personal growth through affective restructuring, which is just another term for emotional readjustment. So in client-centered therapy, this is Carl Rogers' form of therapy, where he emphasized the client's natural tendency to become healthy and productive. Notice that the name of the therapy itself, client-centered, reflects sort of the underlying belief about the individual themselves, that these are clients, not patients, in the sense that it's believed that there's nothing wrong with these individuals per se, but just that they could use some assistance in terms of maximizing their ability to function. And this is done largely through the therapist providing an accepting atmosphere and encouraging healthy emotional experiences. But the clients are held more responsible in this type of therapy than in psychoanalytic. So the major techniques that are employed in client-centered therapy include empathy, which is an insightful awareness and ability to share another's inner experience. That is, empathy is just when we can sort of experience for ourselves what somebody else is experiencing. Okay, unconditional positive regard it involves love and acceptance with no contingencies. So, according to this theory, that's one of the major reasons that people experience psychological distress, is because they have received conditional positive regard, which means that they were only told that they are cared for or loved if they do certain things. And so demonstrating that people are accepted for who they are, that's sort of what unconditional positive regard is. Genuineness and authenticity is a therapist characteristic. It means that you can't pretend to be interested. You have to truly be honest and forthcoming in terms of your thoughts and feelings with the client. And this is important in terms of developing rapport with the client, which is really one of the major uh, uh, um, methods through which this therapy is believed to be effective is through the therapeutic relationship itself. And then finally, active listening, which involves things like reflecting, paraphrasing, and clarifying what the client is saying. And by doing this, this communicates to the client that the therapist is genuinely interested and is paying close attention. Now, in terms of evaluating humanistic therapies, there is evidence for the efficacy of client-centered therapy, although one of the criticisms of the evidence in support of this is that it's really more of a non-specific type of factor that can be seen in essentially any therapeutic relationship. That is, there are no specific mechanisms about humanistic therapies, or according to some would argue this, but rather it's just the idea of being in a therapeutic relationship and talking to somebody who is empathic that results in the gains. The criticisms, similar to psychoanalysis, are that some of the core concepts are difficult to empirically test. The data on outcomes rely largely on the self-report of clients. That's actually very typical of just about all psychotherapy studies. But there's also mixed results on some of the specific techniques, such as the degree to which the unconditional positive regard, for instance, is really a necessary component of effective psychotherapy. Okay, the cognitive therapies are therapies that treat problem behaviors and mental processes by focusing on what are believed to be faulty thought processes and beliefs. The idea here is that people engage in self-talk, which is an internal dialogue. The things that people say to themselves and the way that they interpret events are sometimes not the way that they actually are. So, for instance, if somebody says, I like your dress, a person could take that in a few different ways, right? They could believe that it was said honestly and sincerely, or they could believe that it was said sarcastically and that they really don't like the person's dress. And so, because of the belief that, or the underlying theory being that most of a person's problems will be related to their misinterpretation, a big part of cognitive therapy involves cognitive restructuring, which is the process of attempting to change destructive thoughts and inappropriate interpretations. So, as I said, the cognitive therapies really are more are more similar to cognitive behavior therapy than strict cognitive therapy. Again, the distinction is just to what extent do you utilize more behaviorally oriented techniques. And as I said, cognitive behavior therapy is more common than just strict cognitive therapy. So, an example of using cognitive restructuring, a negative interpretation and self-destructive talk leads to destructive and self-defeating outcomes. But positive self-talk and beliefs leads to more positive outcomes. So what cognitive therapists believe is that it's not the events that happen, but rather your interpretation of those events. And if you interpret them negatively, that's going to result in negative affect. Negative affect meaning negative emotional experiences. If, on the other hand, you take a more positive outlook, and the idea is not to be overly positive, but just to be realistic. That is, people who experience depression and anxiety, for instance, they tend to have unrealistic views and interpretations. And so the idea is just to test out the reality of those views and try to develop a more accurate interpretation. As I mentioned, there are two major forms of cognitive therapy that emerged in the 70s and 80s. One is Albert Ellis's rational emotive behavior therapy. This is a cognitive therapy that attempts to eliminate emotional problems through rational examination of what are assumed to be irrational beliefs. That is, anytime you hear the word must, should, always, never, these are believed to be reflective of mis- mi- misinterpretations or irrational beliefs, because things are, it's very rare that we must do things, and when we think that we should do things, the idea is that, well, there's not necessarily a reason why we should do them. We may want to, but whether we should or must or need to do those things, it's believed that that's where the irrationality comes in. So Albert Ellis talked about the ABCDs of most psychological disorders, where A stands for some sort of activating event, B stands for the person's belief system, C stands for the emotional and behavioral consequences, and D stands for disrupting the erroneous beliefs. So during therapy, Ellis would help the client identify these ABCs and help them to recognize their self-defeating thoughts, and then help them to, more importantly, dispute these beliefs to create new, more what again Ellis would argue are more rational beliefs. Now, the other major form of cognitive therapy is Beck's cognitive therapy, which again is characterized by distorted thinking patterns, as most cognitive therapies assume. And Beck talked about some specific ones. He talked about selective perception, which is focusing selectively on negative events while ignoring positive events. These are some things that he noticed that people who are depressed are particularly likely to engage in. Overgeneralization, drawing negative conclusions about one's self-worth on the basis of maybe just one incident, for example. Magnification is an exaggeration of the importance of undesirable events and seeing them as catastrophic and unchangeable. And all or nothing thinking, which refers to seeing things as black and white categories. Everything is either totally good or totally bad, right or wrong. People view themselves as either a success or a failure, and those are extremes, which are unlikely to represent reality. It's unlikely that anyone is a complete failure, or that anyone is completely bad, but rather those are believed to be extreme views that represent distorted types of thinking. Now, cognitive therapies have received, out of any type of therapy, I would say, the most empirical support for a number of different psychological problems. This includes depression, which is what it was originally developed for, but also anxiety disorders, bulimia, anger problems, addiction, procrastination. Even it's been used in the treatment of schizophrenia and insomnia. The criticisms are that it does ignore unconscious processes, that it may overemphasize rationality, it may minimize the importance of the past, although it does take into consideration that our core beliefs about ourselves are largely developed in the past, but the idea is not to focus on the past. It's more focused on the present, and the use of behavior techniques rather than changing cognitive structure. But as I said, most cognitive therapists are really more cognitive behavioral in nature, in the sense that they do employ behavioral techniques. Okay, so let's talk about some of these behavioral techniques. Behavioral therapies are a group of techniques that are, again, based on learning principles used to change maladaptive behaviors. They tend to focus on problem behaviors, that is, things that are overtly being displayed, meaning that they're observable, rather than the underlying causes. And so there are techniques that use classical conditioning, some that use operant, and some that use observational learning. The first example of the use of classical conditioning is a technique called systematic desensitization. you'll recall that classical conditioning occurs when one stimulus becomes associated with another stimulus, which comes to elicit a conditioned response. We looked at the development of fear in little Albert. That was done by John Watson. This was believed to be a model of how phobias can develop. And so systematic desensitization, it begins with relaxation training to get you in a relaxed state. It's followed by either imagining or directly experiencing various versions of the feared object or situation, and there's a hierarchy that gets developed so that you start out with something that's only mildly aversive, such as if you have a fear of snakes, you might start by imagining a line drawing of a snake, but then you would progressively move up to maybe a picture of a real snake, and then maybe a fake snake toy, and then maybe a snake in a live snake in the other room, and then you being in the same room. And the idea is that you systematically work through this hierarchy of fear-evoking stimuli while attempting to stay relaxed. And the idea is that you replace this anxiety or this fear response with relaxation, because those two responses, anxiety and relaxation, are believed to be incompatible. That is, you can't be both relaxed and anxious at the same time. Another example is aversion therapy, where in this case you condition, say in this case alcohol, by pairing it with a drug called antabuse. The antabuse prevents the breakdown of alcohol in the bloodstream, and so it builds up to toxic levels extremely quickly because we can't metabolize it. This leads to nausea, and then the alcohol becomes associated with nausea, and that will reduce your likelihood of wanting to drink alcohol. It's no different than the learned taste aversion that we talked about earlier as well. Now, in terms of operant conditioning, we've talked about reinforcement and punishment, and these are essentially the major techniques that are used to try to either increase appropriate behaviors or desirable behaviors, or to decrease undesirable ones. So we've talked about the concept of shaping, which is providing rewards for successive approximations of a target behavior. An area of treatment that involves extensive use of these procedures is called applied behavior analysis, and this is actually the most effective technique for working with specific populations, predominantly those who have mental retardation and autism. Of course, it's not limited to those populations, but those are some notoriously difficult to treat populations with behavioral methods, and those are the most effective methods. Now, in terms of observational learning, it's been shown that this can be useful sometimes for treating phobias and for social skills and assertiveness training, those sorts of things, where a therapist will simply model the desired behavior and then provide the individual with an opportunity to practice it, and so that's also a behavioral method. Now, behavioral therapies, they also have a great deal of empirical support. They have been shown to be useful specifically in the treatment of phobias and obsessive compulsive disorders, autism, intellectual disabilities. Those are the areas that have a great deal of empirical support in the use of those techniques for those disorders, but it can also be applied to other areas as well, eating disorders, delinquency. Some of the criticisms have to do with the generalizability to the real world outside of therapy. That is, you might get something to work inside of therapy such that you can get a person to experience a feared object, but when they go into the real world, do they still demonstrate those abilities? And then in terms of ethics, it can be questionable about the use of punishment. That generally speaking, you want to try to use punishment sparingly and use reinforcement, as much as possible. But some would argue that it's a little bit ethically controversial, by that you're limiting somebody's freedom by utilizing controls over the rewards and punishers in an individual. Okay, so now we're going to talk about the biomedical therapies, which, as I said, are using physiological interventions to try to reduce or alleviate symptoms. These include drugs, ECT, electroconvulsive therapy, and psychosurgery, and they're based on the premise that chemical imbalances or some disruption in the nervous system is involved in mental health problems. So in terms of drug treatments, there are four major categories. The first major class are called anti-anxiety drugs, which are more often known as anxiolytics or minor tranquilizers. These essentially, are most often used to treat anxiety, but they're used to treat other things as well. And they generally work by lowering sympathetic activity of the brain, which, as we talked about, is largely responsible for the physiological symptoms of anxiety, but they can also reduce alertness, coordination, and reaction time. Of course, anytime you're dealing with the use of a pharmacological agent such as a drug, you need to be aware of potential side effects and interactions. Antipsychotic drugs or neuroleptics are the second major class. These reduce agitated behaviors, hallucinations, delusions, and other symptoms associated with psychotic disorders. They're largely used in schizophrenia. They traditionally work by decreasing the activity of dopamine, which we've talked about in the past. Mood stabilizing drugs, the major one is really lithium. This is the sort of gold standard in terms of the treatment of bipolar disorder. It's actually not known very well how lithium works exactly. It is believed to have an influence on sodium channels, which affect the ability of neurons to fire. But in terms of the main mechanism that allows lithium to reduce the frequency of these mood disruptive symptoms, the manic symptoms and the depressive symptoms, is not all that well known. And the fourth major category are, of course, the most common category, the antidepressants. These are used primarily to treat depression, but as I said, they're used for a number of other disorders as well. Sometimes they're used for anxiety disorders, sometimes they're used for eating disorders, and even sleep disorders. There are different classes of antidepressant drugs. There are one class called tricyclics, one called MAOIs, monoamine oxidase inhibitors. Monoamine is just refers to a class of neurotransmitters. It includes things like serotonin, norepinephrine, these drugs inhibit the reuptake. There are SSRIs, which also block the reuptake of serotonin, and there are norepinephrine reuptake inhibitors. Serotonin and norepinephrine reuptake inhibitors. So these drugs work mainly by increasing the bioavailability of those neurotransmitters, serotonin and norepinephrine. Those are the main targets of the SSRIs and SNRIs, and they're the most commonly used forms of antidepressants. Now, electroconvulsive therapy is based on passing an electrical current through the brain. People probably have some misconceptions about how this works. To be honest, scientists don't really know exactly why it works the way that it works, but it is shown to be quite effective at treating severe depression that is not responsive to other means of treatment. That is, ECT is usually used as a last resort. Okay, it's not used to treat schizophrenia as widely as it was in the past, before we knew that there were more humane and effective treatments. That's what ECT was often used for, was for treating schizophrenia. It is still used to some extent today in the treatment of schizophrenia, but it's much more often used for again, the most severe levels of depression. And it's often used as a last resort because of the potential adverse side effects, which include temporary disruptions of memory impairment, but there are also potential long-term effects that are not as well known, so it could extend beyond more short-term memory problems. Psychosurgery is an operative procedure, of course, on the brain that's designed to relieve symptoms that, again, have not responded to other forms of treatment. It's generally used when patients, again, have not responded at all to other forms of therapy. One of the outmoded or outdated forms of psychosurgery is called the lobotomy. This is a procedure in which you cut the nerve pathways, usually between the frontal lobes and the rest of the brain. This would be called a frontal lobotomy. That technique is, as I said, as far as I know, not used any longer. Again, science fortunately showed us that that is not an effective way of treating mental disorders. More recent interventions that have sort of replaced psychosurgery involve a technique called deep brain stimulation, where you implant electrodes and stimulate different areas of the brain, and even more recently, a technique called transcranial magnetic stimulation that is not a surgical procedure but just involves the use of an electromagnet that can actually manipulate brain activity as well. So psychopharmacology, obviously, these are this is one of the most common, based on the number of advertisements that you see on television. This is a very big industry. It may provide relief, but it's generally not seen to be as a cure. That is, there's a relatively high relapse rate associated with psychopharmacology. It can also result in physical dependence. There are side effects and potential long-term effects, and they can be overused and overprescribed. In terms of ECT and psychosurgery, these are controversial. They can result in seizures as well as memory loss, as I mentioned. Psychosurgery is very rarely used today. Really, it's only in the most severe cases. And as I said, ECT is being replaced by other more, or I should say, less invasive procedures such as transcranial magnetic stimulation. Okay, so if we think about all these different types of therapy, they're all designed to do some of the same things, except certain therapies target one type of goal more so than another. So all types of therapy are attempting to change disturbed thoughts, disturbed emotions, disturbed behaviors, as well as interpersonal and life situation difficulties, and essentially return the brain to a more balanced state. That is, ultimately, if we experience a change in our mood as a function of psychotherapy, there has to be a brain representation for that, and that brain representation largely reflects changes in brain pattern activity and which involves these neurotransmitter systems. So, although we've been talking about these different types of therapy as discrete forms of therapy, but in reality, most therapists, particularly most psychotherapists, actually identify themselves as eclectic, meaning that they combine different techniques from various theories in order to find the most appropriate treatment. Now, in terms of evaluating psychotherapy, controlled research, there's been an abundance of research done in the past few decades that has shown that psychotherapy is, without question, effective. The classic study that's used to reference this found that about 75% of those who receive treatment are better off than those who do not. So it works for the majority of people. Short-term treatments can be as effective as long-term treatments. That is, you don't need to undergo years of psychoanalysis in order to treat a behavioral problem or a psychological problem. Short-term therapies can be effective. A combination of therapy with medication is usually more effective than just using medications alone. And some therapies are more effective for some specific problems. As I said, the behaviorally oriented therapies tend to be most effective for anxiety disorders, specifically phobias and obsessive compulsive disorder, whereas uh, cognitive therapy tends to be one of the most effective for the treatment of depression. Okay, now in addition to these major forms of therapy that we've talked about, there are different formats that therapy can be engaged in. One form is called group therapy, which is a therapy in which a number of people meet together on a regular basis to talk about problems in their lives. Now these could be either led by a therapist, that is group psychotherapy, or they could be self-help groups that don't involve the use of a leader who is a therapist. Self-help groups are generally you know designed as support groups. That is, individuals going through similar experiences meet together. So, for instance, a cancer support group or a widow support group, those sorts of things. Group therapy tends to be less expensive than individual therapy, and it can often be used as a supplement to individual therapy. In addition to group therapy, there are also marital and family therapies, which are used to try to change maladaptive interaction patterns within a family or a couple. Usually all members of the family or couple will attend the therapy sessions. They can engage in individual therapy as well, but it's just good to know that these types of therapies do exist. Again, in terms of where the field is heading, one direction that it's heading in is in terms of telehealth or telepsychotherapy, referring to the fact that technological innovations are helping therapists to connect with their patients in more virtual or not face-to-face environments, but rather through the internet, even text messaging, for example, which is obviously easy easier in some cases, particularly when a person is living in a rural environment and may not have access to a variety of psychotherapy resources. And it can also be more cost effective than more traditional methods. But again, this is a newer form of therapy, and there's still a lot of research yet to be done on it.